SAC7108 Vlog 1. Reg number 701111. Athlete A presenting with a capacity issue. As we watch Athlete A set up for the first pull in the snatch, we can see that he is unable to maintain a neutral spine. As the bar comes past the knees, the athlete is then able to brace for the catch, which shows me that he does have the skill to brace, but is possibly lacking the mobility to keep the neutral spine in the bottom. As athlete A descends into the bottom of the squat, we can see that there is an imbalance in the hips. The left hip is sitting a few degrees higher than the right side. Which can be very clearly seen here on the right side. The athlete also maintains quite a high torso angle and is limited by the depth that he can achieve in the squat. We can see again here on the right side, the hips are lower on the right side compared to the left. The athlete does not appear to be compensating for tight ankles, looking stable at the bottom. If we look at the overhead squat now, we can see that the athlete is presenting with
an anterior pelvic tilt,
which he then exaggerates into excessive lumbar extension. The athlete does this to compensate for the tightness in his hip flexor. This also allows the athlete to maintain an upright torso as he descends into the bottom of the squat. This is also an example of the athlete's ability to maintain a neutral spine through the squat and to maintain sufficient intra-abdominal pressure to keep the torso upright and to keep the spine neutral. We can see now another example of the athlete compensating for the lack of flexion on the right side, with the hips sitting offline and the right hip sitting lower than the left. We can see the athlete now on the right side testing for dorsiflexion, and we can see with 38 degrees that he has sufficient flexibility in the ankle for the squat.
Put 6 inches, yeah.
This is also true for the left side. He has 42 degrees dorsiflexion here, which is plenty above normal ranges. I decided to do the Thomas test with this athlete to expose any tightness in the hip. We can clearly see here the right hip flexor is very tight as it lifts off the box. We see that the foot is relaxed, pointing down, so that would indicate that the tightness is coming from the psoas. We can see now on the left hip flexor, it's the same. The left leg is clearly lifting off the box, which indicates a tight hip flexor. The foot is also relaxed, pointing down, which indicates that the tightness is coming from the psoas rather than the rectus femoris. If we compare the angles of the legs lifting from the box, we can clearly see that the left side is lifting significantly higher than the right side. I also measured the athlete's hip flexion. So we can see here on the left side, the athlete has approximately 98 degrees, which is well below normal range. The right side is a little better with 110 degrees flexion. This explains why the athlete's hips are lying lower on the right side at the bottom of the squat. I now take the athlete through some corrective strategies. This is a banded distraction, working on hip flexion. We're trying to increase the range in the glutes. The band comes in at the top of the hip, right on the hip capsule, making sure that the right leg is flat on the floor. We will spend 3 to 5 minutes on each leg. We can work this into warm-ups or in between sets of back squat. We can see further evidence here of athlete A's tight hip flexors as the left leg lifts from the floor. Another corrective strategy is the runner's lunge to the box. We can see here on the right side that the athlete is able to get his torso significantly lower than the left side. He really struggles to bring the knee towards the chest here on the left side. This stretch is more effective if the athlete is able to keep the leg on the floor straight and maintain a neutral spine rather than a flexed back. To further demonstrate that this is a capacity issue and not a skill issue, I will now get the athlete to demonstrate some snatch from an elevated position. As we see, the higher we bring the athlete on the blocks, the better the athlete is able to brace and maintain a neutral spine. This is because we've effectively given the athlete an increased hip range of motion. The lower the athlete goes to the ground, the more he's forced to compensate for his lack of hip flexion, bringing the back into lumbar and thoracic flexion. See here, if we raise the blocks high enough, the athlete is able to maintain a neutral spine with no lumbar flexion, allowing the athlete to perform the snatch more effectively. By raising the bar onto the blocks, we've effectively worked around the athlete's limitations, allowing him to perform the snatch more effectively, demonstrating that this is a capacity issue rather than a skill issue. We move on now to athlete B, who's presenting with a skill issue in the back squat. As athlete B descends into the bottom of the back squat, we can see that his lumbar goes into flexion, or what is sometimes known as the butt wink. The athlete is also leaning forwards, which shows me that he is failing to maintain enough intra-abdominal pressure to keep his torso upright. To rule out any mobility issues, I tested the athlete's ankle range. We can see here with 40 degrees dorsiflexion, he has ample flexion on the right side. And this is also true of the left side with 47 degrees flexion. I also tested the athlete's hip flexion. Raising the foot onto the box like this is also a quick way to eliminate any problems with hip flexion. The athlete's right hip has 134 degrees of flexion, which is well above normal ranges. This is also true of the left side. With 133 degrees of hip flexion. I will now take the athlete through some corrective strategies. This drill forces the athlete to maintain an upright torso while also increasing the intra-abdominal pressure as he acts against the plate. This teaches the athlete how to maintain a proper torso angle and also how to brace in the bottom of the squat. The athlete will perform this drill in between his sets of back squat in order to teach him about more effective positioning. The drill is sufficient feedback for the athlete to be able to improve his motor control skills and effectively eliminate the butt wink or lumbar flexion in the bottom of the squat. The athlete's ankles look stable at the bottom of the squat, however his rack position is poor and it's pushing his chest forward. He needs to hold the bar with a claw grip, lift his chest, bringing his thoracic into extension, which will allow him to maintain a more upright torso. The athlete is also leaning into his dominant side, and we can see the bar is slightly tipped higher on one side.
A corrective strategy for this would be to place a band around the knees, allowing the athlete to get some feedback and keep equal weight in both legs. The final corrective strategy for the butt wink is to hold a kettlebell in the anterior position in the bottom of the squat. This teaches the athlete to maintain appropriate intra-abdominal pressure and also the correct torso position for the squat.